Friends, hope you're doing well. I'm Dr. Milind. So I welcome you all in this our series, Know the Branch from the Specialist. So today we are going to talk about ophthalmology, which is one of the most sought after branch. And today we have a special guest, Dr. Priyadarshana, who have completed her MD in ophthalmology from prestigious AIIMS New Delhi. So let's try to know more about the branch from her. Hi, Dr. Priyadarshana. Please introduce yourself.
Hello. Yeah, I'm Dr. Priyadarshana. I completed my MD in ophthalmology in the month of July 2021. Following that, I have been working in my hometown in a hospital. I'm planning to join a fellowship after this. And so, yeah, you caught me in the right time. So we'll discuss.
Yes, and thanks again for taking out time to talk to us. So tell us about how you made up your mind to take the ophthalmology. Like after a counseling, a lot of students have this question in mind, choosing a career because it's one of the most important decision of your life. So how you end up being ophthalmologist? How you decided to get into the branch?
Okay. So, well, my father is a well-known ophthalmologist. So I had no doubts regarding that. From the very beginning, like I think from 6th standard itself, when people start writing in their slam books, their aims, my thing was like, okay, I wrote, I want to become an ophthalmologist with the wrong spelling, but still I was sure that's what I wanted to become. But yes, I'm well aware that people don't consider ophthalmology as a top branch, especially in India. It is considered one of the inferior branches, things which you take when you get a lower rank. And I partly attribute it to the way things are taught in MBBS. So it is just like, 3 subjects are taught in 3rd year. So ophthalmology, I think, has a marking of 50 marks and everything is taught in a very rushed way. So students don't really enjoy the subject. It is just supposed to be something which is, it's a subject which is supposed to get passing marks. That's about it. Even during taking exams, so it's a very short and sweet exam, and nobody has much of an interaction with the ophthalmology department. So that's about it. I believe that is a major role in people not taking up ophthalmology. Secondly, before it was considered to be an N branch. Now we're realizing that the branch is just evolving and people have to take up a lot of fellowships and also they're like, okay, is it even worth it? Because if you take up subjects like, for example, pediatrics or medicine, it's very simple to set up. You have your own set of stethoscope, just a chamber, and you'll charge money from the patients and they'll keep inflowing. But for ophthalmology, it's just not like that. We'll need to have specialized equipments like a slit lamp, like, indirect ophthalmoscope, direct ophthalmoscope, which requires a lot of investment. So probably that's why also people don't think it to be a top branch, but the situation is completely reverse abroad. It's considered to be one of the most chilled and most sought out branches abroad in contrast to India.
Yeah. And I think also just adding to your point, even in internship, we get like only 2 weeks of exposure to ophthalmology. So how are you supposed to know about, the branch? Like other branches on the contrary, like pediatrics, you get 1 month, medicine, PSM, even for PSM, you get 2 months of posting.
Yes.
So it's very, that restricted time that you have. So it becomes difficult. And as you rightly said.
And all we hear about ophthalmology is cataract. I don't think anybody would be interested if you just mentioned cataracts. I mean, it's so boring, right?
Yeah. Yes, exactly. And if it was only about the cataract, they wouldn't have made another branch dedicated to it. So I think it is one of the very important branch that to be looked up. Also,
it is. Yeah.
Yeah. So what was your experience in residency? Tell us about, a lot of students who have no exposure of ophthalmology, how the ophthalmology department works, and, how was your residency, like 1st year, 2nd year, 3rd year, how it is divided and how is the workload?
Okay. Actually, I had joined ophthalmology previously in a state medical college also, and then I got shifted to AIIMS Bhopal, and then I got upgraded to AIIMS Delhi. So I had different experience in all the 3 different institutes. So in AIIMS Delhi, I've got to say it exceeded all my expectations. It was like class apart, honestly. And I got to work with all the stalwarts of ophthalmology, like Professor Titial, Professor Ramanjit Siota. They were class apart. And I think, here, the basic problem lies with how we go about ophthalmology in most of these state medical colleges or even in the central institutes, right? It is not given much importance. And I believe things are taught in a very boring way. And any field would be interesting if you make up your mind that you would do something about it, right? Even people would initially be hesitant to take up microbiology or say suppose pathology, but people are doing wonders in those fields. I mean, just imagine COVID without microbiology, right?
Yes.
So so that's how about it. But I believe if you've taken ophthalmology as a branch, it has a great scope. And how residency works, like how at least in AIIMS New Delhi, how it worked was that we had 6 units. So each unit had their subdivision, like one unit had cornea and glaucoma, another unit had retina. So we were supposed to stay in one unit for 3 months, and then we rotated. So at the end of 3 months, we had our own clinical test, and they would kind of like, we would keep rotating. So we would encounter each unit twice in our residency, right? And that's how about it goes. So yes, again, in a week, there would be 2 days of OPD, 2 days of OT, and then 2 days of round stay. And Sunday would be mostly free, supposedly free, but it's not. And then, yes, emergency duties. So I believe emergency duties mostly don't exist outside RPC or in most institutes. But yes, we used to have emergency duties. And the way it was taught, I have absolutely no complaints. Like, yes, it was not a cakewalk. Extremely, I mean, like people take ophthalmology thinking that it's a very relaxed branch and they come to relax. But that's why most of the people
that was my exactly next question. So thanks for continuing into that. So is it like, someone looking for a surgical branch and wants like, less hectic? So you believe that's not it's a misnomer?
Actually, if you take it in AIIMS New Delhi, it's not a relaxed branch at all. Most of the people quit because of the same reason, because they expect ophthalmology to be a chill branch, no work, nothing. But it's not like that. I mean, I believe for the first year of residency, we've hardly slept. And I'm not glamorizing the fact that we have slept very less, but I guess we've hardly slept for 2-3 hours and we've still continued our duties. That's how it functions. Obviously, duties get lesser as you become a senior, you're given more time to study. But yes, we have really worked. I mean, I'm aware that things are not the same everywhere. But if you're taking up ophthalmology in Delhi, don't expect it.
You have started in the state college, so it's not the same as per your opinion. I mean, the working hours.
Yes, there's like, so much of difference I can't even explain now. I'm not going to name anything or do crib about it. But yes, there's a lot of difference. But again, I would say that regardless of wherever you're pursuing your post-graduation in ophthalmology, it's up to you to what you become in that field. I have seen people from state medical colleges pursue great careers in ophthalmology. They have become one of the leading ophthalmologists in India. So I'm not saying you have to pursue your ophthalmology from central institutes itself to become great in your field. You can do it from anywhere. What matters is your passion to do great things in life.
Very true. Now that's you summarize about your residency. So now you have already completed your MD. So how was the life after coming out of AIIMS? As you said that we all know that AIIMS Delhi has a completely different environment and quite a comfort space for the people who have graduated from there. So what were the challenges that you faced after, or how was it like, finding a job and, looking as a career into ophthalmology?
Right. Finding a career like as such, there are a lot of senior residency programs and fellowships that are available. You can, of course, apply to that. And that is not much of an issue. Actually, getting a job is not an issue. The main challenge I feel in ophthalmology is that most of the colleges, they don't give you enough surgical exposure, right? You are not given hands-on. So even after a degree in ophthalmology, you are not competent enough to operate, right? So you are like, okay, you can just, basically ophthalmology is supposed to be a combination of medicine as well as surgery. But you can only prescribe medicines to the patient. You are not able to perform surgeries confidently.
Sure.
So I feel that is a major drawback in the residency programs in most colleges. And again, here I'm not talking about colleges like JIPMER or AIIMS Delhi or PGI, where you're given hands-on. But in most colleges, like, students are like flustered that what will we do after post graduation, which fellowship to apply. So yes,
I think
that
this
remains.
issue can be taken care by doing a senior residency in a good institute. Like if you did not
Yes,
have a good
yes,
exposure,
definitely.
I think you can solve that problem. And one thing that you mentioned earlier in the talk about the infrastructure, I think if you want to set up a private, that might, I will not say it's a hindrance, but maybe a challenge for few setting up their own private setup.
Yeah, requires a huge investment. I'll be very honest. So not everyone has the guts to set up their own institute or do their own thing. So I think initially, if they are not that much comfortable, they can work under someone till they build up enough money, to build up their own institute. I feel that is one option that's available. Again, they can go for fellowships abroad if they want more surgical exposure, anything like that.
Yes, and I think ophthalmology is one of the branch which has a lot of fellowships available, and like anyone wants to progress into their career, they always have these options available. And as you have said, you're
Yes,
also joining a fellowship from Monday. So,
yes,
so I think you have taken a step ahead in your career as well. And I think,
yes.
and when we talk about success or earning money in any field, I think it's at the end of the day, it's up to the skills and potential of the candidate itself.
Yes, but just imagine there are so many people in India itself, and everybody is going to get old. Even we will need cataract surgeries. So, yes, money
Exactly.
should not be an issue if you're a good surgeon, right?
Yes, very true. So, the last question from my side. It's just a very simple question. What do you like? What is like, what do you like most about the ophthalmology, and what do you, I will not say hate, but maybe you dislike about something, if you can think of, or just tell me what you like.
Okay. What I love is that there's absolutely zero mortality. I mean, I hate seeing sick patients or people dying in front of
Yes.
me. The time I had to spend in the COVID ward, I was like literally dreading, oh my God, another sick patient dying, another sick patient. So in ophthalmology, we don't have that problem, okay? No sick patients. If the
No,
patient
not
is
that.
sick, we would refer it to a
Different.
physician
Hmm.
and then we'll operate when he gets fine, okay? So zero mortality, and mostly the post-operative results are good, especially for cataracts.
Very
So if
true,
you
very
if
true.
you want so if you want happy patients, go for refractive surgery, go for cataract surgery. Amazing results. Patients will be happy with you.
And they say like vision is one of the most important sense of our life. So giving someone vision, and like someone starts seeing again, I think that is one of the best moment of as a surgeon, that my patient can see
It's
again.
extremely rewarding. Yes, so patients would come with just perception of light vision, and you see the patient walking around in the ward. Patients will be so happy, and I am somebody who derives my pleasure from seeing others happy. And like if I have a patient with a complication next day, I'm like very sad. Okay, how could I have prevented that? So like seeing a good post-operative result matters to me. I feel
That's
that's
a
one of
very
the
kind. That's very
good part.
kind. And anything that you
Yeah.
dislike, you can skip this question, but just asking for the sake of it.
Uh, just
Maybe you want
like
to.
in the
Maybe you want to
sense,
change
yeah,
in the
first of all,
branch.
yeah, so for me it didn't matter to me as much, but for example, if somebody is the only doctor in the family or the only
Mhm.
ophthalmologist, so much of investment is required just to build up his own setup. I think it's mentally grueling. For example, for example, let me talk about my friend. He's the only ophthalmologist in the family. Now he's thinking, how do I take a loan to build my own setup, because he's not comfortable working under somebody. So I feel that kind of takes a mental toll on you. And of course, after doing our post graduation, we are all in the mood to settle, right?
True, true.
We are like, okay, we should start our own family. We should, be responsible for our own finances. At that moment, if we have to take a loan, if we have to be financially dependent on someone, I think it's kind of a
Yes,
drawback.
yes, very true,
Yes.
very true. But I think whatever you have said earlier, it's going to be a very important for all the students who are interested in career in ophthalmology.
I feel they should all study more, because AIIMS New Delhi has so many ophthalmology seats. I mean, one of the highest number, because it has its own center, right? Dr. RP Center. So I feel everybody should study and they should get into it. I mean, worth it.
So thank you so much, Priyadarshana, for taking out time and talking to us. And I'm sure that this is going to be a, that light for a lot of students who are looking for ophthalmology as a career. So thank you so much, and I wish you all the best for your fellowship as well.
Thank you. Yeah.
Thank you so much.